post-electrostatic stimulation. Why it is effective? This is another study to study the mechanism. The study on the blood, the calcium level, because the calcium level is related to the health of the muscle, of the bone, and the heart and other tissue. Yeah, it's quite important. So this study shows that actually there is this is before the treatment. It's 9, right? And the level after the treatment, immediately after 20 minutes treatment, is 9.5, slightly increase in the calcium. Okay, here is a summary of the result. A group average. Again, this is from a group of people and calculate the average. This is before the treatment is 9.5, and after the static field stimulation is a 9.9, slightly increase, right? So anyway, this show you don't feel any stimulation, but this changes the calcium level in your blood. And I'm doing a study on the effect of this treatment on improving the recovery of post-stroke patients. You know what is stroke? A patient with hypertension and suddenly paralyzed of the limbs. So the arm, the leg cannot walk, cannot move, the arm cannot move. It's because there's either there's an embolism in the blood vessel in the brain, or there's bleeding in the brain because of long time hypertension. So after stroke, the patient will enter rehabilitation. It lasts for a long time. They can walk again, they can move, but usually there's some disability, residual disability, so can move but not that good. And so because this is also related to the blood circulation, to the oxygenation of the tissue, so we just taste the effect of this treatment in patient 4 weeks after stroke. Because within 4 weeks, usually they are in the ICU, intensive care unit. They cannot do any rehabilitation. Then we divide the patient in 2 groups. A group is daily 30 minutes with this treatment at the level 7 or level 9, and the other group without any. The machine is off, not on. Then 4 weeks, only 4 weeks time. So we test the movement ability of the patient. So first, actually we plan to complete this research just in Stephen, what time was our original plan? I remember it's in April, right? Yeah, the original plan was in April. We can complete because only 24 patients. It's quite easy but up to now we have not yet completed this product because in the control group, the patient come to treatment for 2 or 3 times, and then they will not come again. Yeah, because there's no effect. No? So the dropout rate is very high. We have already, actually, for the treatment group, we have completed. Because the patient they come again and again, and then we can provide successfully 28 days treatment, and then evaluate the final report, the result. But the other group, the patient come a week, and they will not come. Then we need to recruit new subjects. So I think we can complete this. So by end of October. So because of the very high, the dropout rate actually already show the effectiveness, right, of the treatment group. So we compare the final outcome, the walking ability, and also movement of the arm and the language and so on. So in treatment group, it's significantly improved when compared with the other group of patients. And also, we measure the tissue. We use an infrared machine to detect the brain, the tissue oxygen level. So in the control group, it's around 70%. So 70% normal tissue, it is more than 85%. But in the injured tissue, so there's only around 70% in post-stroke patient. This is why the rehabilitation lasts very long time, because there is a lack of oxygen in the brain area, the injured area, so the healing lasts very long time. But in the other group with this treatment, daily 30 minutes, the level between 7 and 9. So the oxygen situation is between 82 to 90 something, but on average it is around 23% higher than the control group. And this can explain why their movement ability restored more faster than in the control group, because of the high oxygen situation. And this provides evidence that this machine actually it can elevate the oxygen situation in the brain tissue. And what is the difference? 23% is when you live in Malaysia or you go to Tibet. So no, Tibet is very high and very few oxygen, right? So if you go to Tibet, then the oxygen situation in your brain has decreased around 20%. So your response will be very slow, and you'll have headache. Yeah. So this is because of lack of the low oxygen situation. So after stroke, actually, the oxygen situation dropped also around 20%. But with this treatment, it can again elevate it to a normal level. So this is an evidence. Again, it can be effectively used to treat the stroke patient.